Hello and welcome. We are pleased to present to you this video on clinical outcomes with a Diffractive Trifocal Intraocular Lens, a worldwide pooled analysis of prospective clinical investigations. So let us begin by discussing the design of this analysis. This study was a pooled analysis of 6 prospective clinical studies of patients bilaterally implanted with the Acrosoft IQ PanOptix Trifocal IOL model TFNT00. Data were obtained from 56 sites across 16 countries, providing outcomes in 557 patients of different ethnicities. Let's introduce you to the first authors of the studies included in this pooled analysis and give you a brief overview of the populations involved. From Professor Kohnen et al., we had a multi-country post-market study conducted across 17 sites in Europe, Australia, and Chile. Another multi-country study involved in this pooled analysis was conducted by Dr. Lapid-Gortzak et al., a post-market investigation conducted across 15 sites in Europe, Australia, and South America. From Dr. Modi et al., we had the FDA-approved multi-center US non-randomized controlled investigational trial. From Dr. Ramamurthy et al., a post-market multi-center study in India. From South Korea, a post-market multi-center trial from Professor Kim et al. And finally, from Japan, data from an investigational multi-center clinical study from Professor Bison Miyajima et al. From this overview, we can truly appreciate how wide and varied the patient demographics were in this pooled analysis. Because similar methods were used in each study to assess visual outcomes, we were able to pool all of this data, thereby providing a better understanding of how the trifocal IOL TFNT00 performs amongst a global population. Due to variation in time points at which outcomes were assessed, and to provide the greatest sample size for this analysis, visual outcomes were pooled for the 3 and 6 month time points. This approach was made possible by the refractive stability displayed by TFNT00 at the month 3 postoperative visit. This pooled analysis demonstrated an excellent range of binocular vision with TFNT00 at 3 to 6 months postoperatively. At distance, visual acuity peaked at 2016. For 66 cm intermediate and 40 cm near distances, patients achieved 20/20 vision. For the entire range, TFNT00 provided a continuous range of 20/25 or better vision from distance to 33 cm. When analysing the pooled mean binocular uncorrected visual acuity data, TFNT00 achieved 0.05 logMAR or better vision at each tested distance. This translates into 20/20 uncorrected binocular vision at distance and intermediate, and 20/20 to 20/25 at near. When analysing the pooled mean binocular corrected visual acuity data, TFNT00 achieved 0.021 logMAR or better vision at each tested distance. This translates into 20/20 corrected binocular vision at distance, intermediate, and near. In addition, TFNT00 demonstrated a favourable safety profile, with only up to 2.2% of patients reporting ocular adverse device effects following implantation. And so, to recap, in this pooled analysis of 6 studies across 56 sites in 16 countries involving 557 patients, the trifocal IOL TFNT00 provided a favourable safety profile and achieved distance-corrected vision of 20/20 or better at distance, intermediate, and near for patients of different ethnicities, thereby providing a continuous range of vision to patients across the world. Thank you for watching this video, and please follow the link to learn more from the full published study.